We're back now, joined by Dr. Stephen Cook from URMC, works at Golisano in the pediatrics department. I guess we're moving ahead. We're getting closer to the school year. Apart from, when we do get the headlines of the first case, the first student at wherever school comes down with COVID, what is your main concern as we look ahead to the fall?
It's really important that the schools and the public health departments know what everyone's role is. And the good thing in this community is that they've been in constant contact with their local health officials in terms of identifying symptomatic individuals and if they need to be tested, if cases are identified, and then working with the public health departments in the contact tracing, which is really a crucial role. And the schools are ready to step up to work with them, because this is not just a matter of one kid being out sick for a day. It's then requires questions of who was exposed or not exposed and what steps need to be taken next. And based on what the schools are talking about doing, they sound very prepared and are really working around the clock to try to make sure everyone, not just the students, but teachers and staff, are safe.
You mentioned the tracing aspect. Say if there's elementary or a high school kid who has it, parents will immediately think, my student's in that class or my student is with them. But we've heard that this is going to be case by case. There are levels of separation between how much contact. Can you walk us through how that would work whenever you're considering how close someone comes into contact with someone who later tests positive?
Yes, that's a great question and a very important point. Being in close contact really would be in close proximity for a long period of time, 15 minutes or more. If it's a even longer period, even with a mask, there can be some concerns. So if a child comes in on a Monday morning, first thing off the bus, and they come into the classroom and they're in there a few minutes, and then they look kind of peaked and maybe nauseous, and the teacher walks over and they feel warm, that kid may get sent down to the office. But if the kid has only been in the room a few minutes, they may not contact trace or need to contact trace anyone in that classroom. So every case is different. The Department of Health has that protocol, and they will look into that, assuming it is a positive case. That's the other thing. There are lots of things that make kids look lousy, feel run down, and give them a fever that aren't COVID as well.
Yeah, I was going to ask you about that as well, because the CDC's been updating the list of the symptoms, and it's, at this point, you look at it, and that's everyday things that people wake up and it could be bad apples one morning, maybe strep, what should parents be looking for when their kid wakes up and might have a tickle in their throat or might feel a little hot?
I think the first thing is, if their child is sick and have any symptoms, they need to keep them home. They need to contact their primary care doctor right away. This is not a time to give the kid a dose of Tylenol or Motrin, send them on their way, and hope they make it through the day, because that's just going to lead to a lot of trouble. It's best to monitor your children, and the schools have symptom screening plans in place, looking at both reported symptoms, history or travel exposure, as well as temperature checks. So there's a number of steps in place. But if a parent is concerned that their child doesn't feel well, they really have to keep them home.
Just recently, we saw a headline come out from the American Academy of Pediatrics that they looked in the second half of July. It was nearly 100,000 kids tested positive. That was the most significant spike since started in March. Do we have a real baseline for what this will look like in our area? Because when schools shut down, it was right getting near the peak, not nearly as much testing, not nearly as much known. And now we're getting to a part of the year where all summer we haven't had a number of kids in school. We haven't had this lifestyle going here, and where our rate has been below 1% for some time frame. What should we be looking for?
So the really important point is that at different phases of this pandemic, we're looking at different things. Early on, we didn't have testing and probably didn't have much disease in our community. In these schools, especially in these high numbers we're seeing in July, these are in communities with 5, 10, 15%, if not higher, transmission rates in the community. We're at 1%. It's very low. And going back to school, going back into congregate settings, if we're using the protections, the masking, social distancing, we will be okay. We need to be alert. We're not going to face what the South is facing, because they are really swimming in it. We are at a very low rate. So it's really important to focus on continuing to do what we've been doing. If you estimate in a routine year, maybe 1% of kids get sick during a school day. But if we have more social distancing, kids aren't in contact, washing hands more, we might actually even have less than that. But even that could be a big number if we have to start looking at contact tracing. So, or at least taking these kids out and testing them, not contact tracing, but considering that they may have symptoms and exploring that further.
What's your advice for parents and getting their kids to wear the mask? I know there will be breaks and they'll have to have it on nearly all day long, apart from where they're more than 6 feet apart, or if there's recess time they can be outside. What do you tell them?
Kids are going to go to school to learn how to read. They're going to learn how to write, tie their shoes. They're going to learn how to protect themselves and others by washing their hands and wearing a mask if need be. So getting the kids exposed to it, making it fun, making it a game, making it an appropriate type of mask too. And look at your schools. The schools are gathering these resources and showing parents, what are some things to do, because some kids may need to get used to it, and you should start now.
Next to health and safety, the big challenge now is how the fall is going to be so much different than last spring.
My discussion with teachers up next.